third week of the 2018 Kentucky General Assembly was another abbreviated week due to the Martin Luther King holiday. Legislators did not gavel in until 4 p.m. on Tuesday, which did not allow much time for movement for many bills, including several KMA priorities. Much discussion during the early part of the legislative session has centered on the potential benefits of a $1 tax increase on cigarettes. The effort gained significant momentum this week when the issue received an informational hearing by the Senate Health and Welfare Committee. The Kentucky Chamber of Commerce, as well as directors from Kentucky's two cancer centers, the Markey Cancer Center and the James Graham Brown Cancer Center, provided testimony lauding the health and revenue advantages that could be gained by the tax increase. The panelists stated that such advantages are needed considering that smoking and smoking-related illnesses cause nearly 9,000 deaths in Kentucky each year and cost the state more than $2 billion annually, with $700 million of that amount covered by the state's Medicaid program. After the testimony, Senator Alice Forgy Kerr made a motion for the committee to recommend increasing the cigarette tax by $1. Senator Danny Carroll seconded the motion, and the motion carried. Meanwhile, Senate Bill 2 and Senate Bill 20, tort reform measures both sponsored by Senator Ralph Alvarado, remain in committee with hearing dates that have yet to be determined. KMA will keep members updated on any movement regarding this legislation, and members are still asked to contact their senators in support of these important bills. Please call your senator and ask them to support Senate Bill 20 and Senate Bill 2. House Bill 4, another KMA priority introduced by Representative Adia Wuchner, would protect the peer review process to allow physicians and hospitals to assess their work without the possibility of their words being used in a medical malpractice claim. House Bill 4 is expected to be heard very soon by the House Health and Family Services Committee. However, opponents of House Bill 4 are lobbying hard to prevent the legislation from moving forward. Members are asked to continue contacting their representatives to relay their support for this important legislation. So please call your representative and ask them to support House Bill 4. On January 16th, Governor Matt Bevin outlined his budget priorities in a combined State of the Commonwealth and budget address. In addition to the full funding of the state pension system, $34 million was proposed in new money to tackle the opioid crisis, with additional millions focused on mothers suffering from an opioid abuse disorder. In order to fund those initiatives, the governor proposed a 6.25% across-the-board cut to state government, along with the elimination of 70 state programs. A link to the budget supporting documents is available at the address on the screen. With just 3 weeks to go, members are reminded to register for KMA's Physicians Day at the Capitol, scheduled for Wednesday, February 7th in Frankfort. Members are strongly encouraged to wear their white coat to Physicians Day. This small gesture will allow KMA members to stand out, as well as send a powerful message to policymakers by demonstrating strength and unity among the medical community. Register for Physicians Day at the Capitol by visiting kyma.org.